Hello, my name is Adam. I will be doing a video on IV insertion. So I am looking over my MAR right now. My patient is Mary Smith. Her date of birth is 5/18/1963. I see she has an allergy to morphine, and she has some new orders on here from her physician. She came in with dehydration, so she is getting some fluids, which requires an IV, and we also have some medications as well that require IV push. So I gathered all my supplies, and we're gonna go in and do the procedure here. Knock, knock. Good morning, Mary. My name is Adam. I'll be your student nurse today. I'm gonna shut our blind here, give us a little bit of privacy, okay? All right, wash my hands here. So first things first here, Mary, what is your full name and date of birth? She says Mary Smith, date of birth 5/18/1963. We look at her armband. Her armband checks out. Mary Smith, 5/18/1963. Okay, Mary, do you have any allergies? She says yes. She tells me morphine. That checks out. Do you have any other allergies? She says no. Okay, so we have a procedure. We need to insert an IV, okay? Have you ever had one before? She says that she has. She's familiar with the procedure. So it is a needle that'll be inserting into your arm, and what that needle's inserting is a catheter, which is a tubing, and we're gonna leave just the tubing in, not the needle. We'll keep that in so we can give you some fluids. Your doctor ordered fluids because you came with dehydration, so we're going to correct this problem for you, okay? All right, so first things first, I asked her if she has any fistulas. Any lymph nodes removed, and we ask this because these are contraindicated to have an IV inserted. We have to use a different extremity if so. She does not have any of these, and usually we use the non-dominant arm. So in this case, it's her right side, but it's her left arm here. So I also assessed that she is able to follow commands, which is also important. So she's able to do so. So I also have her in a supine position, high fowlers, and she's comfortable, she says. Her arm is in a dependent position. This is the position that we like for this type of procedure. So what I'm going to do next, Mary, is we're going to put I put a chucks underneath here. This will collect any sort of fluids or anything so we can keep your bed nice and clean. You can also use a towel as well. Okay, so what I'm going to do next is I'm going to have my supplies here. We're just going to get things set up, all right? So I have my 10 milliliters of saline, normal saline here. We're going to use this because we're in a saline lock, and that's what we use to help prime the tubing. So I'm just going to take out any air and the garbage here. Okay, so that's good. Got some alcohol swabs here. We're going to clean the end. Good. Okay. Alright, I'm just going to prime our tube. Get the air bubbles out. We don't want air to go inside the veins, so there we go. We got that primed. Mary, I'm just going to set this tubing right next to you, okay? Alright, so next thing's next here. What we're going to do is we're going to have this tourniquet here, okay? So this goes around the arm here. This helps protrude your vein so that we can find the best vein to use for your IV site, okay? So you want it tight, but you need to check. Some things we'll check here to make sure it's not too tight. First off, Mary, how does that feel? Okay, it feels okay. It says it feels fine. I'm going to check her radial pulse. I see that we have a radial pulse. This is good. We do not want to occlude the arterial veins here, the blood flow, okay? So you can assess the site, find the best area, the best site here, the best vein. So I see we have a nice straight vein here. Some ways to get those veins to dilate is you can tap. You can take our tourniquet off, apply some heat source up to 15 minutes. That'll help dilate veins as well. So I see here, this is the one that I'd like to use. Like I said, dependent. Looks great. All right. So let's just pop that off right now because you only want that on for the max of 2 minutes. All right, so let's use a little bit more hand sanitizer. We're going to put some gloves on here. Very good. Okay. I have a transparent dressing called a Tegaderm. I'm just going to set in my area here. Get it ready. Okay, I have my tubing here set up. I have another alcohol swab here. And I have my 20 gauge needle here, okay? So we'll just set this here. So we're going to clean in a circular motion about 15 to 20 centimeters below tourniquet. We'll put that back on right before we insert here. So circular motion right here, working outwards up to 20 seconds. Okay, 20 seconds, we'll let this dry. Okay, so now that we have that, we can while that's drying, we can reapply this here. That should be the right amount of time or so. Okay, recheck. We still got that radial pulse, says no pain. So, okay, we got our site here. So, what we do, caps off, bevel up, taut with your thumb, okay? So you're gonna go to about 15 to 20 degree here. And we got a flash, then you level, go down, insert another 1/2 centimeter. You're gonna progress your catheter. Okay, you're gonna pull out, lock your needle. Okay, everything's looking good so far. Let's just make sure that we can flush a bit here. Oh, excellent, good, we're flushing great. So I'm gonna apply a piece of tape here, tape it down, keep it in place. Everything okay, Mary? All right. So everything feels great, better than the last one that she had, she's saying. So here we got it taped down. What we can do next is we'll put on our transparent dressing. Okay, you're doing very good, Mary. We're almost done. So it's going on top. And it's gonna go right here. Okay, make sure it's on there nice. And then we have this outer coating here. And that's gonna come off like so. Make sure it's all pressed down. And so what we have is there's a little piece that's on here that we put our name. We got that. Got my initials, the time, the date, and the gauge here is 20 gauge. So we're gonna put that on. All right, we're gonna finish flushing now. Nice and slow. Okay. All right. Move. Gonna lock this here. I'm gonna put another little piece of tape up on it here. Get it out of the way from dangling. We don't want it to get caught on anything and have it rip out. Cause extra problems for our patient. We don't want to be the cause of that, right? Okay, so we got everything secured here. So what I'm gonna do is I can throw away my locked needle here into the sharps, and maybe the saline, if this happened to get blood in it and stuff, we could throw it also inside the sharps container. So up here, I'll throw this away. Mary, how you feeling? She says she's feeling good. I'm letting her know that we're all done. She said she's not in any pain from it or anything. I'm gonna clean up my area here, throw away everything, and then I'm gonna remove my gloves, wash my hands, and some lifespan considerations here that we could consider, or some things to note, is that a pediatric patient, they sometimes have a hard time with needles, so maybe having their parent with them would help calm them down. If you have a geriatric patient with real thready veins. You can obviously apply heat to dilate the veins, or if they're real thready, you can use a butterfly needle, which is a lot smaller. So that's some lifespan considerations. I'm going to go document, but before I document, I'm going to make sure we got a low bed. She has her call-light, she's comfortable, her side rails are up, she has everything she needs within arm's reach, her call-light. Letting her know, give us a call, let her know, you know, the future plan here with medications and whatnot. So I'm gonna go document, obviously my procedure. So how many attempts it took me. I'm gonna put that I used the 20 gauge. We put it inside the left AC. That the patient tolerated it well. We had no complications with it. Obviously, we'll put in document the right time and when it was done. This concludes my first video of IV insertion.